Have you ever heard of angioplasty? It's a medical procedure that can save lives. Today, we will explore what angioplasty is, how it works, and why it's crucial for heart health. Angioplasty is used to open blocked arteries. These blockages can lead to heart attacks or other serious health issues. Understanding angioplasty helps us recognize its significance in treating heart problems. So, how does the procedure work? First, doctors access the coronary arteries. They use a thin tube called a catheter. This catheter is guided to the blockage. Once it's in place, a balloon at the tip is inflated. This balloon compresses the plaque against the artery walls, widening the passage for blood to flow. After the balloon is inflated, a stent is often placed. A stent is a small mesh tube that helps keep the artery open. It remains in the artery permanently, providing support and preventing reblockage. You might wonder, how effective is angioplasty? Many patients experience significant relief from chest pain. They often feel healthier and can resume their daily activities quickly. For example, imagine someone who always felt fatigued and struggled with physical activity. After angioplasty, they notice a remarkable improvement. They can exercise without discomfort and enjoy life again. It's key to remember that angioplasty is not a cure for heart disease. It's part of a broader treatment strategy. Healthy lifestyle choices are essential for heart health. In summary, angioplasty is a vital procedure for treating blocked arteries. It helps restore blood flow and improves patients' quality of life. If you or someone you know is facing heart issues, consider talking with a healthcare professional about angioplasty. If you found this information helpful, be sure to share it with others. Staying informed can lead to better heart health for everyone. Thank you for watching.